The numbers are startling here, and I was just watching the county announce that there are 6,000 confirmed cases of coronavirus right here in Nassau County. I think it's, if we're in relation to states, we'd be number 3 at this point, next to New York City, for the areas that have it. And as a result, we are seeing a strain on our local medical services, a strain that is requiring some additional help and getting ahead of this continually. That's something we've tried to do here in the town of Hempstead, and that's why we are now jointly calling on our U.S. senators to declare and deploy a national disaster medical system right here in the town of Hempstead. By declaring a national disaster medical system through the support of our U.S. senators, they can deploy teams to this region to set up tents and facilities to deal and help those individuals who have non-coronavirus related injuries or problems. What does that burden do? It takes them out of the hospital and puts them into different field tents. That is what is taking place in New York City, and that is what we need out here on Long Island. But we need the support of our U.S. senators to help get that done and help get that mechanism in place. And this is not the first time this has taken place. After Superstorm Sandy, right here on Long Island, they did such a deployment. And again, it helped to alleviate the burden that was being placed on our hospitals. And we all see the reports on TV. You see the lines at some of these hospitals. You see the stream of ambulances going in. And I know firsthand that there are many first responders who have indicated to us that this is now having an effect on the services they're able to deliver to some of the residents.
There's some of our hospitals, there's people waiting a couple hours to try to get into triage, and it's not the fault of our medical professionals. They are doing the very best that they can. They are providing every resource that they possibly can. But we're hoping that the U.S. Department of Health and Human Services, if deployed, can set up this DMAT team and really kind of take the stress off of our hospitals and doctors. You know what, if you're a resident or you're a neighbor who's suffering something that has nothing to do with the coronavirus, you could be transported to this location and be treated.
Even though we are holding our own for now, it's time to call in reinforcements. We do not want to get behind. We are seeing this clear increasing need for medical resources, for facilities, for personnel, and that is what the National Disaster Medical System could do for us here. I do serve as a member of that service, of NDMS. I was in a DMAT here in Long Island after Hurricane Sandy, and I have served in other locations after disasters. And the resources that they bring from Health and Human Services help augment and supplement the system, help the system work better, make sure that the system is getting what it needs. It's a proactive step.
I served 22 years as a first responder in the Port Authority Police Department prior service with the NYPD. Right now what we're dealing with is we're dealing with a stretch of our manpower. First responders are stretching to the max. Our hospital capacities need to be increased because the curve is still ahead of us. So I join my colleagues in calling on the federal government to help us with this capacity and to help us with the resources that we need.
All your levels of government are working together, and at this point, that's why we're reaching out to our federal representatives. We need them to help have this deployed in this area. By having the National Disaster Medical System placed here, it will get ahead of this. You have to really think of it that everything is funneling down into one hospital. Every case of coronavirus, every injury, everything else. By having these alternatives set up, and we're willing to, help with the federal level and find locations here in the town of Hempstead, areas to do it, we can alleviate that congestion, we can alleviate that burden that is happening to our hospitals, our tremendous first responders, our medics, our nurses, and all of them. And it's about being proactive that is going to help flatten this curve.